If you ask me that I could have only one hormone in my body and I had to absolutely get rid of every other hormone from my body, so pick just one, guess which one I would pick? I would pick thyroid hormone. It is an extremely important hormone for our body, for our metabolism, for our energy, and for our longevity. And guess what? About 10 to 15% of the adult population actually has thyroid hormone disorder, most of the time in the form of low thyroid hormone or abnormally low functioning thyroid hormone, which is quite unfortunate because it means that we are not performing at our optimum level. So what do we need to do? Well, first of all, we need to recognize and identify this problem. So if you are someone who's suffering from fatigue or have difficulty maintaining weight or losing weight, you're seeing problems with your hair, you are having problems with your skin, you're seeing some puffiness in your body, if you have gastrointestinal problems, for example constipation, and you just feel depressed or any of these things, you can see that it is possible that you have a problem with your thyroid hormone. So with this you can see that thyroid hormone affects almost every single system and every single organ in the body. So what do we need to do? We need to test for it first. So not only we check for thyroid stimulating hormone, which is the basic screening test, but we can also test for the subcomponents, which are the T4 and T3 hormones. And T3 hormone is the active form of the hormone, which is very short-lived, so testing it is not all that valuable, but checking for T4 definitely gives us some added information. Now when we start the treatment with thyroid hormone, and there are multiple formulations available. So there is most commonly used thyroid hormone preparation is in the form of T4, and most people actually benefit from this formulation or this medication. But if you are someone who is taking the medicine and is still not feeling better, then it is possible that you are someone who is not able to appropriately convert T4 to the active T3 form, or a lot of that T4 is getting converted into reverse T3, which competes with T3 and causes a disruption in the action of T3. So that in that case, we can actually use alternate treatments which are in the form of T3 or even combination treatments in the form of T3, some part T3 and some T4. So we can play with these hormones and try to optimize your level. Finally, if you are taking thyroid hormone treatment and you've started to see results, but not all the way to what you want them to be, then definitely start paying attention to other things. Start to see what could be causing suppression of your thyroid hormone endogenously. So some of those things are poor diet. So if your diet is not healthy and does not contain sufficient amount of zinc and selenium and iodine, then maybe your thyroid hormone is not going to function well. And then there are some amino acids, for example tyrosine, which is important and essential for proper function of thyroid hormone. So do look for food sources which contain zinc and selenium and tyrosine especially, and see if you are getting enough of it. And if you're not, then of course you can always get a thyroid support. It is always best to get your supplements from foods, but if you are not able to for whatever reason, then definitely a product or a supplement can be purchased as well. And if you do happen to have a thyroid hormone problem, then here is something, there are two very, very important things to keep in mind. The first thing is to figure out if this is a problem related to an autoimmune condition, which is called Hashimoto disease. Because if you do have Hashimoto disease, which is what the vast majority of hypothyroid or low functioning thyroid patients have, then it is actually a telltale sign that your immune system is not working well. And if you have one autoimmune disorder, guess what? You are at risk for developing more or additional autoimmune disorders. So we need to start looking at the neighborhood of this autoimmune disease. And the neighborhood of thyroid related autoimmune disease, Hashimoto, is diabetes and rheumatological conditions, which means that if you are genetically predisposed to having Hashimoto disease, you are genetically predisposed to having other autoimmune diseases as well. The second thing to keep in mind would be that if you do have a thyroid balance problem, then it's not just limited to your thyroid gland, it basically means that you are at risk for developing long-term complications associated with abnormal thyroid hormone as well. And what are those? Those include cardiovascular problems, fertility problems, muscle problems, and then of course problems associated with abnormal aging and longevity. So we need to start monitoring all of those long-term complications as well. So it's extremely important, if you have a thyroid problem, keep your regular visits, make sure that your levels are checked appropriately, and make sure that we do monitor and test for all those complications associated with long-term thyroid hormone problem. Thank you.